we had a childcare system that was broken before the pandemic even started. And the pandemic just brought out how broken it is and was to the forefront, so that people started talking about it, people started paying attention to it. Families that have been using childcare all along knew how broken it was, but the whole society as a whole did not really understand how much parents were paying for childcare, how expensive it is, and with the pandemic, how broken the whole system was. So I wanted to do a study looking at and talking with parents to find out how they handle childcare in the midst of a pandemic. I got so many parents that wanted to be in the study. It was just amazing. I didn't have to worry about not having enough families, because I had like over 100 families that wanted to participate just in the first couple of days alone. I only needed 25 families. And so I had one foster mom, one dad, one non-binary person, and the rest I had moms that were in our study. It was great. So many families have been staying home for such a long time. Besides their children, they had really no one to talk to, even though all the families would say something like, I really enjoyed having time with my children, but they also had a really hard time. And sometimes the negative stuff is not heard because no one wants to say, I couldn't stand having my children at home with me. I just needed a break, because moms and other parents were not getting that break ever. Moms and dads were telling me chaos, the worst time ever in my entire life, nightmare. When they think back, they were like, oh my gosh, how did I survive it? I was surprised because I had done a study in the summer of 2020 where families were really leery about sending their kids back to childcare just because of the unknowns, and they were really frightened about COVID, and they didn't want their kids to get it or them to get it. So they stayed home. Everyone stayed home. For this group of families that I interviewed, almost all of them sent their kids back to childcare. They were eager to send their kids back because they felt that for their own mental health, the kids' mental health, they needed to go back to childcare. So many of the families went to the same centers they had used before, the same family childcare providers, families that had used grandparents or other relative care. They had thought by people having vaccines, it was easier to see each other, and they would get and grandparents would once again watch the children. And for the families themselves, not everyone's gone back to work. They're still working from home. One parent told me the work culture is never going to be the same. And I think a lot of people would agree with that statement, because the whole idea, how are you going to get your work done if your child is home with you? It's not going to happen. So the kids are back in childcare. It may be for shortened periods of time, may not be as many hours as before, maybe not as many days as before, but they are going back to childcare. And they're still facing the same incredible problems with the cost of childcare being way too expensive for most families. Well, a couple families decided for health and safety reasons, they went from a center to a family childcare home, thinking a smaller setting might be safer or more healthy than a larger setting. I had a couple families that had to not use childcare centers anymore because they couldn't afford it. They had to reduce their own hours, so they weren't getting paid as much, and they couldn't afford childcare. So in terms of a center, so what they used, I had one family who used a friend for a while as a babysitter. That got too expensive, so then they went to grandparent care, which was didn't cost anything, and that's how they were able to make it. One good thing about the pandemic is that people that were on subsidies did not have to do any kind of copay since March of 2020. Now that may change this fall. So, and the other problem is not everyone who needs a subsidy gets it. The wait list is way too long, and it's not being taken care of because there are not enough seats and there's not enough money to afford everyone a subsidy that needs it. So families were telling me that we're on subsidies going, I don't know what I'm going to do in the fall or when we have to start paying our co-payments. First of all, one of the reasons why the system is broke is that teachers do not get paid enough. They don't get paid a living wage, and they often have to work 2 or 3 jobs in order to even pay for their own rents and mortgages and stuff like that. So some of the money will be going to keep teachers in classrooms, which is important because right now there aren't enough teachers to fill classrooms. There may be kids waiting to go into a center, but there's not a teacher, so they can't be in. For families, I think that if we can extend the child tax credit, if we can get families beyond 2021 to get that money, that will also help families pay for the childcare. It's not going to pay for all of childcare, but it's going to help. And then I think we need to redo the subsidy system so that families that need more than just the tax credit can get the care they need so that they themselves can work. I fear that because schools are opening up again in the fall and that kids are going back to, are either in childcare or going back to childcare, sooner or later parents will be going back to work, that people are going to think it's going to go back to the way it was. And it can't go back because we can't sustain the system of childcare we have now. We can't go back to the way it was. It's got to be built better. It's got to build, we have to start up from the ground up and build a better system. And because childcare is not leaving, you know, it's one of those things. Families have been using childcare for years and years and years, and I think we need to build a better system. One finding I think is that employers need to really think about what their expectations are for their employees, because employees are burning out. We knew that the moms and dads I spoke to, they were all used up. They had nothing left to give. So I think employers might need to implement things like flex time, paid parental leave, because even though Massachusetts has, not everyone does have that, and just lower expectations. Don't make your employees stay up till 2 or 3 in the morning to get their work done, because they're going to burn out. They cannot last that long. And I also think if parents are going to, they want to be good employees, they also want to be good parents too. And to be good parents, they need to, if they need help with their mental health or anything that's troubling them, I think they need to get that help, because they can't help their children or do the best for the children until they themselves are well.